Hello, everybody. Thank you for your patience. I'm not sure what was happening with the presentation, but I'm happy to see you here. Welcome, welcome. We have, let's see, we have an hour and a half together this evening to talk about all things related to medical English. For those of you who were prepared to come last night, who maybe did come last night and logged on, I'm so sorry. I was not able to make it. We had a huge connection problem. I could not get it resolved in time. And so thank you for coming to the rescheduled program tonight. All right, so let's just get started because we have some we call this housekeeping in English, the initial rules that we go over. Let me find this section that I want. Beautiful. Okay, so welcome to the course. Oops, we skipped over. This is me. I'm Ariella. I'm an English teacher living in Algeria, and I run the American Institute. This is the program that we're following. You can see that we are on the second out of a total of 6 classes. So last week was our first class. We did an overview to medical terminology in English. Today, we're talking about everything related to communication between doctors and patients, between doctors. This includes things like specialized vocabulary in English, maybe some jargon, some slang, as well as certain communication tools that we find in the medical field. We have 4 weeks after this. We'll be doing things really relevant for pharmacists, things around medication management, prescriptions. We'll be looking at medical exams, mental health, and then conferences, research, and this kind of training seminars in the medical space. So stay tuned because we have a full program in June. Although tonight is Monday, our normal night that we meet are Sundays, Sunday evenings at 6:30. We have some course rules. Please participate. Please participate in the chat. And even today, we'll have some opportunities to come on the mic if you want to join on the microphone. We just ask that you stay appropriate and you stay on topic. Disclaimer. So if you were here last week, you remember that I shared, this is the first time I've ever had to put a disclaimer in a presentation, but I think it's very important that everyone here understand I am not a doctor. I am an English teacher. And I have a decade of experience teaching English and teaching English for specific purposes, ESP, as well as EAP, business English, lots of different specialized language. But this is still a language class, which means that I might get something wrong as it relates to a medical question, or maybe I've misunderstood the role of a certain professional in a context. So you'll have to excuse that level of education in the program. I'm not here to explain medicine. I'm here to try to bring some specialized English communication skills and vocab to those who are interested in working in the medical field or perhaps are already working in the medical field. So that's all to say, don't hesitate to correct me if I get something wrong. Thank you in advance. All right, today we're going to talk about importance of building clear and concise communication. We're going to be talking about rapport, building rapport and patient-doctor interactions. Rapport, you may recognize it if you're a French speaker. This is a word that we also use in English. It means the same thing. It means a relationship or a dynamic. And we pronounce it in the French way, like rapport. We don't pronounce the T. And then I think this is good. Let's get moving. Building rapport and interactions within the medical field. We're going to start there. So what types of interactions will you be faced with if you are in the medical field? We have interactions between the doctor and the patient, between doctors, okay, discussing patient care, for example, between doctors and other healthcare professionals. So there are not only doctors in the hospital, and doctors have to interact with nurses, with student interns, with training doctors, with a whole host of other people who might come from other departments. And then we also have doctors communicating with administrative staffs. Oh, someone's telling me they're not seeing my slides. Thank you, Yassine, for letting me know. Are you all seeing my slides? I should be on a red slide that says doctor, patient, doctor, other healthcare professional. Aha, thank you for letting me know. Let me reshare it. I wonder if it's still connection problems. Wow, I'm glad you told me now. Imagine if I had just been, did the whole presentation on your end, you couldn't see the slides. All right, what do you see now? Do you see a red box? No, is good. Thank you, thank you, thank you. If you start noticing that I'm talking about something that doesn't match the slides, please let me know. You can also hear because I'm making a little sound every time I'm moving the slide. So if you're hearing that and nothing's happening for you, then we have a problem. All right, I'm going to try to change the slide. Tell me if you can see the changed slide. It should now say doctor-patient interactions with a picture of a doctor and a patient. Can you tell me this? This will help me know if it's moving correctly. Ah, interesting. So it will show it to you, but it won't move it. Now, yes? Okay, all right, okay, let's try it. So doctor-patient interactions, I'll say next slide, so you know, now I'm on a next slide. The question now is, how formal should patient-doctor interactions be? How formal should patient-doctor interactions be? This is not a question for you. I'm going to answer it. I have a question for you in a second. So essentially, doctor-patient interactions, the dynamic, the communication between a doctor and a patient, they need to be in between formal and informal. They need to be informal enough to build trust. So between a doctor and the patient needs to trust the doctor, to trust that the doctor has their best interests at heart, to trust that the doctor is giving accurate information, that the doctor is giving full attention to their care. And so when we want the dynamic of full trust, we rely on some informality, maybe sharing personal anecdotes. Some people hug their doctor, right? They really do have a relationship that is not formal, at what 100% formal. And yet the relationship also needs to be formal enough to respect professional boundaries, remembering that the doctor is an authority figure and that this is not a friendship based relationship. So let's look at some key elements of patient-doctor interactions. And here we're really trying to talk a little bit about primarily the English side, but when we talk communication, we bring in other elements. Yes, we'll be doing English language focus, but to use the language appropriately, we need to be on the same page about what that communication goal is for the doctor. What is the goal of the doctor? So in this, in patient-doctor interactions, we have a goal to have efficient and precise communication. We want to make sure that information is shared in a way that is clear, not confusing. Oftentimes in a medical context, we need to share information quickly. If we're dealing with some kind of emergency, that we actually are able to effectively communicate, here's the situation, here's the decision, here's all the extra sort of justifying information you need to know to make the decision, and then we make the decision. Okay. There's also an element about ethics here. So there's a human aspect when doctors are talking to patients. It's not simply about announcing the diagnosis. It's about considering the person in front of you, considering their emotions, seeing how they might react, helping them digest what could be bad information, what could be stressful information. We'll be going into examples later, but it's the doctor who's the one who's responsible for that first piece of information to the student, the patient. Maybe they have a chronic illness. The doctor is the one who has to break that news. Good patient care is person-centered, taking into account the patient as a whole person, not a disease, not a condition, but a whole person. So there's two things we're going to talk about that are more directly related to English. And these are things that we use in medical settings. Not me, because I'm not a doctor, but we being English-speaking doctors, medical professionals, use these to make interactions with patients more fluid, to make them easier, to make communication, to keep communication strong. So the first one we'll talk about is called using layman's terms, explaining medical concepts in layman's terms or simplifying medical terms for patients. Tell me in the chat, what do you think layman's terms means? You can look, I'll show you back at the last slide so you can see here that we do define it a little bit. We say simplifying medical terms, okay? But if you had to put it in your own words, what do you guess it means when we say layman's terms? Send me something in the chat, write me an answer. Okay, Manel says to specify technical words in a simple word, okay? Good, thank you, Manel. Anyone else? What does it mean, layman's terms? I'll show you this slide. Okay, Yassine says, in a way anyone can understand. Okay, good. I'm going to give one more minute. If there's anything else folks want to share. What do you think layman's terms means? Simple terms, explaining something simply, simplifying things for patients. Yusra saying plain English. I like this, plain English. Easy to understand. Many answers. Thank you. Explaining to someone who has no idea about scientific information, simple language for patients to understand, communal words or common words. Great, thank you everyone. So the term layman refers to a person who is not an expert or a professional in a particular field. It's a little bit of an old-fashioned term that you don't find commonly used except in this context. So we call something layman's terms, but we do not commonly say, that's a layman, or, oh, I'm just a layman. No, we don't use it that way anymore. This is old English. It's not common, but we do still say layman's terms. So in the context of understanding layman's terms, I want you to know that a layman basically means the common man, the average man. Oops. Therefore, layman's terms means using non-technical, simple language that anyone can understand. So you guys got it completely correct. Good. Now we're going to practice. Here's an example of a technical medical explanation. So the quotes, this is like a medical professional, like a doctor delivering this news to a patient. So the doctor says, you have myocardial infarction, which is a blockage of blood flow to the heart muscle. This blockage is often caused by a buildup of fatty deposits, cholesterol, and other substances in the coronary arteries. We need to perform an angioplasty to clear the blockage and restore blood flow. So how many folks here understand what this doctor means? Myocardial, no idea. Angioplasty, no idea. A buildup of fatty deposits, no idea. Someone's guessing in the chat, maybe they're talking about a heart attack. So now let's look at the next slide and see layman's terms, the same condition. So it's going to be the exact same condition, the exact same scenario, but using layman's terms. So Sarah, who sent that this was about a heart attack, was correct. So the simplified explanation, or the layman's terms, are you're having a heart attack, which means that one of the blood vessels that supplies blood to your heart is blocked. The blockage is usually due to fat and cholesterol building up inside the artery. We need to do a procedure to open up the blocked vessel and get blood flowing to your heart again. So this, I mean, for me, this doesn't even feel super simple. It still feels somewhat technical. It still feels somewhat complicated. Thinking about blood vessels, I'm thinking about arteries, blockages, you know, as someone who's not a medical professional, this doesn't feel like super dumbed down. It doesn't feel like you're talking to a child, which means I still feel like I'm being respected. I'm not, I don't feel condescended to, right? But compared to the doctor's language, it's very simple for the doctor. So I use this example to show you that even though for the doctor, it's simplified, for the patient, it's still really appropriate for the level. All right. So now I would like you to try to simplify the next example. And I have to say, if you are just here because you love learning English, marhaba bik. However, we are going to be relying on medical professionals in the chat. I hope we have some medical professionals here, because if you're not a medical professional, this will be a really hard exercise. But you know what? Try your best. I'm going to give you a few minutes to work on it. So if you use Google, that's totally fine. There's no rules here. Okay. But here is the big technical language. And I want you to send in the chat examples of how we can simplify it. So I will read the example. You have gastroesophageal reflux disease, GERD, which occurs when stomach acid frequently flows back into the tube connecting your mouth and stomach, the esophagus. This acid reflux can irritate the lining of your esophagus. Treatment options include proton pump inhibitors to reduce stomach acid and lifestyle modifications such as dietary changes. Whew. It's a long one. Do your best, even if you just do one sentence at a time, or even if you just do the first sentence, but I'm going to give 2 minutes, and I want to see if you can send me something in layman's terms. Okay? 2 minutes, everyone. This is not simplified. No, this is the technical term. Just give it a try. Maybe just try the first sentence, or just try the last sentence. See if you can think about how to simplify this language, because that is very important in medical English settings. When you're talking to patients, we don't use technical language. Amina started us off beautifully saying you're having, I see, Amina, you wrote you're having stomach burn. I would say you're having a stomach ache. Okay, you're having a stomach ache. This is what we call it when we feel pain in our stomach. Any kind of pain, we feel stomach ache. All right, 1 more minute. Rim says you have stomach acid reflux. Great. Hisham says she is pregnant. I don't think she's pregnant. All right. Someone says it's a chronic condition where stomach acid frequently flows back into the esophagus. But I think that's what we just said, right? The tube connecting the mouth and the stomach, leading to symptoms such as heartburn, regurgitation, chest pain. If left untreated, GERD can cause more serious health issues. So to me, this is a little bit similar to the language we have here. It sounds like it's just definitions. All right, you have acid reflux, meaning the acid in the stomach goes up the throat and causes a burning sensation. You can have a medication to reduce the acidity of your stomach and change your eating habits to reduce the acidity of the stomach. Very nice, Yassine. I like this. So we don't go into the specifics of the medication. You just say there is a medication that will have this effect. Great. You have a serious stomach problem, which can cause you reflux every time. To treat it, you need to take treatments with diet change. Okay, thank you, Nordine. Manel, you have a condition called GERD, where stomach acid keeps coming up into your throat, which can make it sore. To help, you can take meds that reduce stomach acid and change your diet a bit. Nice. I think it's great. All right. Thank you, everyone. Let me show you what we have here. You have a condition called GERD, which means that acid from your stomach keeps coming up into your throat. This can cause a burning feeling and irritation. To help with this, we can give you medicine to reduce the acid in your stomach and suggest some changes to your diet and habits. All right. Something very simple and basic and almost exactly the same as Manel's. Wow. Nice. Number 2, we're going to try it again. We have diabetes on this one. The medical explanation is you have type 2 diabetes mellitus, which means your body is not using insulin properly. This leads to elevated blood glucose levels. Management includes dietary changes, regular exercise, monitoring blood sugar levels, and possibly medication or insulin therapy. 2 minutes. What is a simpler way to say this? Oops. Take another minute. Let me know when you have something. Okay, I see Hisham saying she has diabetes and she needs to inject it. Okay. Oh, sorry, she needs to inject it. No, she has diabetes and she needs to inject insulin. Very good. Okay. Type 2 diabetes is a chronic medical condition characterized by insulin resistance, where the body cells do not respond effectively to insulin. This leads to elevated levels of glucose sugar in the blood. Nice. These are really fancy answers, you guys. You have what we call diabetes, type 2, which means sugar level is high in your blood. We can treat this with medicine and some dietary habits changing. I think this is great. It's super basic. It gives the name, it gives the definition, and a few comments about lifestyle. Because of the high proportion of sugar in your blood, you have to exercise and take medication to reduce sugar. Your blood is not using insulin properly. You have to change your dietary habits in addition to taking insulin. Great. Let's see what I wrote. Great. So we have, it looks like you have type 2 diabetes, but don't worry, there are lots of ways to keep your blood sugar in check and to stay healthy. By making some adjustments to your diet and getting regular exercise, along with keeping an eye on your blood sugar levels, you'll be able to manage it well. And if needed, we have some great medications that can help too. Okay. Very, very non-medical terminology, but the same core information is included. Amina, since you're having a long-term condition, we would call a long-term condition chronic, a chronic condition. Your body can no longer regulate sugar levels, which will take, your body can no longer regulate sugar levels, but this won't be a problem if you can go ahead and take insulin and have a good diet. Great. Thank you so much. We have one more, but I think we're just going to move on into our next section. So the next section here is about sugar coating and empathy. Before I move, I want to see if anyone knows, what is sugar coating? What do we mean when we say sugar coat? What does it mean to sugarcoat? What does it mean to sugarcoat? To make something less scary. I mean, it says to add sugar. Well, in a sense, yes, to add sugar is also in the abstract. That's what we mean when we say sugar coating. We're just adding abstract sugar, right? So what does it mean, abstract sugar? You have to be nice with the patient. You have to talk in a nice way. You have to be nice and show empathy. I have Ikram saying insulin is not a treatment for type 2 diabetes. This is an example where you should only take my English advice, not my medical advice. Do your own research on the last slide about diabetes. All right, back to sugar coating. Haneen is saying to make something seem more positive or pleasant than it is. Okay, let's go ahead with that. I like this. So the definition I have for you is it's talking about something, describing something in a way that makes it seem more pleasant or acceptable than it is. Okay, it's a way of kind of softening when you have something that is hard to hear. In a medical context, we're usually thinking about diagnosis. When you go to the doctor and you have something that's bothering you, that's painful, and you get it tested and it turns out it's a really serious condition. When the doctor comes to you to explain to you that, in fact, yes, you do have a condition and it will affect your life, that moment is a really, really hard moment. It's hard for the patient to receive the news. It's hard for the doctor to give the news. And so I'm not saying that doctors should sugarcoat, but I want you to become familiar with this communication technique so that when you're in these situations, you can decide if it's something you would like to do or not. And maybe in different situations, it's more appropriate than in others. So here's an example of technical sort of basic delivery of sort of bad news, bad medical condition. And then we'll go over what the sugar-coated version is. So here's the medical explanation. You have advanced rheumatoid arthritis. This means your immune system is attacking your joints, causing chronic pain, stiffness, and swelling. There is no cure, and it will worsen over time. Treatments include strong medications with serious side effects and physical therapy. You should prepare for a decline in mobility and possibly needing assistive devices. Ouch, that's hard to hear. So you have a disease. It's a chronic disease. It's in an advanced stage. There's no cure. It will only get worse. And you will have a decline in mobility, meaning eventually you might need to use a wheelchair. You might need to use what we call a walker. I can put this here. A walker is for someone who doesn't have good mobility and they push it in front of themselves and they lean on it to walk. Okay, so these are assistive devices. So this is delivered, there's nothing wrong with this. It's completely accurate, but it could be considered harsh. It's hard news for the patient to hear. And so now let's look at a sugar-coated version of sharing the exact same information. Here's the sugar-coated explanation. You have rheumatoid arthritis, which affects your joints. The good news is that effective treatments can help manage your symptoms and improve your quality of life. While it's chronic, medications and physical therapy can provide significant relief. We'll monitor for side effects and help you maintain your mobility. What do you think? Do you think it is fair to say something so positively when it's a really tough condition, or do you think it is nice to sugarcoat? Do you like the sugar-coated or do you like the medical? Tell me in the chat. I'm interested to hear your opinion. The second one is more pleasant, definitely. It's more pleasant, good. Which one do you prefer? Do you prefer the medical or the sugar-coated? Manel prefers the sugar-coated. Yassine asks, aren't we hiding part of the truth by not mentioning the possible worsening of the condition? This is the ethical question. Is it ethical to sugarcoat to make someone feel more positive than perhaps they would if they heard it in a different setting? Sarah says the psychological aspect is important. Yeah, so the sugar-coated one really takes into account or really prepares for the psychological aspect. Reham says it depends on the case. Okay, sure. You could say with some things you don't sugarcoat, with some things you do. Maybe it depends on the type of patient you have in front of you. If it's someone who's older, it's different than someone who's really young. Ikram says she prefers the sugar-coated. Amina says we should be neutral. Yeah, that's the question. Sugar-coating, is it neutral to sugarcoat, or does it show kind of a tendency to diminish the importance of something? Okay, Abdul Jalal says it's recommended to use the sugar-coated. Haneen says you could use the truth as it is without sugar-coating it, but you could say it in a positive way. Yassine is saying he's preferring the second version, and I would go to that doctor again, but I wouldn't go to the first one. So that's interesting. So doctors may actually lose patients if they're too harsh. Okay, Ikram saying when the patient is optimistic about his disease, he will get better. So actually, yes. So earlier, Sarah, when you said the psychology is important, I was thinking about that moment of receiving news. But there's also the question of a patient who feels more optimistic may actually slow a disease or recover more quickly from a disease. So there could be a reason or a justification for the doctor to sugarcoat beyond simply wanting to soften bad news. Okay, great. All right, let's try something together. I want you to help me sugarcoat. Whether or not you agree with sugarcoating, this is more about language to see if you can redo the language in a more positive and softer way. So here is the kind of medical term. You have chronic kidney disease. Your kidneys are not functioning properly, which can lead to waste buildup in your body. This condition is progressive and may eventually require dialysis or a transplant. You'll need to follow a strict diet and take medications. All right, so this is someone finding out they have a chronic illness that gets worse. That's what it means when we say this condition is progressive. It means it gets worse. And then he's saying, the doctor is saying you might need dialysis. Dialysis is daily. I believe it's daily. Perhaps it's weekly, but I think it's daily, where the patient has to go every day to a clinic to get the external support for the kidney. So it really, really affects your lifestyle, or a transplant, which is surgery, which also really affects your lifestyle and your overall health. So I'm going to give you 2 minutes. I want you to type a version of this that is sugar-coated, please. We'll take 1 more minute. Send what you have in the chat. If you have something, I'd love to see how you would sugarcoat telling someone they have chronic kidney disease. How would you sugarcoat it? All right, someone is telling me, I don't think there's any way to sugarcoat this without lying. There's no way to sugarcoat it. Did anyone else find a way to sugarcoat? Okay, you have chronic kidney disease. For now, we have a solution called dialysis, but we have to follow your condition and then we'll decide what we're doing next, okay? You have a chronic kidney disease, which prevents them from filtering your blood filtering your blood properly. This condition is progressive, but could be slowed down by a good diet and medications will accompany you through the process. It may need dialysis. Your kidneys are not functioning well. You need dialysis, but don't worry. Thank you, Wafa. Don't worry. I see exclamation points at the end, like you're trying to really cheer on the patient. All right, anyone else? Ikram says, you have chronic kidney disease that may need dialysis later, only if you don't respect medication and dietary changes. Fortunately, there's a possibility of a kidney transplant if this gets worse. I like that, Ikram, because you're actually sharing the same information, but you're mentioning that, in fact, it's very fortunate to have the opportunity to do transplants. This was not always the case. So yeah, we could look at this as negative, like, oh, there's a risk of a surgery and the risks that come with surgery, all of this. Or you could say, isn't it great that there is the possibility of getting a new kidney if things really don't improve? All right. I'm sorry to tell you that you have chronic kidney disease. Your kidneys are not functioning properly, so we have to follow a strict diet and take medications to avoid more complications. You have to be serious, and I am here for help. You are not alone. Very nice, Manal. I like that. You are not alone. All right, let's see what we put. All right, the answer, or sort of the version we gave, there's no right answer, right? This is just one option for sugarcoating. You've been diagnosed with chronic kidney disease. Well, this means your kidneys aren't working as well as they should. With proper diet, medications, and regular checkups, we can manage the condition and slow its progression, helping you maintain a good quality of life. What do you think? Which one do you prefer? Do you think the sugar-coated is too nice? You can see the emphasis on the sugar-coated one is about quality of life. Proper diet, we can manage. That's where the emphasis is. In the other one, the emphasis is about the disease, defining the disease. Like you see, this one doesn't actually define the disease at all. The last one defines it as your kidneys not working, waste buildup. The sugar-coated one doesn't even mention surgery. It doesn't mention dialysis. What do you think? Is this good or is it bad that it doesn't mention these things? Amina says, it doesn't sound sugary. It's simple and nice. Well, Amina, thank you for saying that, because sugarcoating, when we say sugarcoating in a language context, I'm sugarcoating what I say, is actually a way of saying it's simple and nice. So that's perfect if it sounds simple and nice. Sugarcoating is not supposed to sound like super, super over the top sweet. It's not that. It's not so literal as sugar, but it is a way of saying you simplify and you make something nice. So Yassine is bringing up kind of the main concern, just like in last time, part of the truth is hidden. Like we don't say right here that the disease could lead to dialysis. But you have to imagine that the patient is still going to talk to the doctor. This is a conversation. It's not an announcement. So the doctor, by opening with something like this, is leaving time and space to provide details later. We often call this, and I'll put it in the chat, softening the blow. So softening the blow, it's an idiom from a sports context. So the blow is like the hit. So if you imagine in like boxing and you get hit, this is the blow. So to soften it is just that initial hit. We try to make it softer. So this is what we're trying to do here. All right. Yeah, and interesting that Ikram is saying, so Yassine is saying, we're hiding part of the truth by not mentioning the possibilities. And Ikram actually responds and says, but complications don't occur in every patient. So you could call it hiding the truth to not mention these things, but you could also say by mentioning them, you're giving the patient wrong information that he will definitely or she will definitely have complications. Here is the last one we'll do. This is a hard one. This is one about cancer. So this is the kind of medical, technical, blunt, that's what we'll call it, the blunt and direct one. Your test results confirm you have lung cancer. The cancer is at an advanced stage, which means it has spread beyond the lungs. Treatment will involve aggressive chemotherapy and possibly radiation. The prognosis is poor, and the treatments will have significant side effects, such as severe fatigue, nausea, and a weakened immune system. All right, what do we mean by prognosis is poor? That's medical terminology for something. Prognosis. Tell me in the chat. Who can tell me in the chat what it means? The prognosis is poor. I mean, it says no high hopes. Okay, good. I'll give another 20 seconds if anyone wants to add anything here. Yassine says the outcome isn't good. Ikram says profit the maximum of what's left. Sure. Sarah says the percentage is low. Yeah. So when we say the percentage is low, we're talking about the likelihood that you will survive. Prognosis is the possibility of survival. So in this, person sharing about cancer, they're telling them it's not likely that you will survive. Not only do they say that, the prognosis is poor, saying it's not likely you'll survive, but also the treatments, while you're being treated, while you're still alive, the treatments have really big side effects, such as fatigue, nausea, and a weakened immune system. So that's tough. That's a really tough one. I want you to try to sugarcoat. How would you sugarcoat this? I'm going to give you 2 minutes. Knowing everything, I agree with everything that you said about the importance of the psychology of the patient, staying optimistic, of still having clear information, still understanding, but not necessarily feeling the most negative. Manel is saying she can't sugarcoat this one. It's hard. Sugarcoating is hard also because it's emotional. It touches us. Having to share really hard news with someone. And this is the role of the doctor, the one who shares with the patient that they possibly have a life-ending illness. So I have here someone saying, enjoy the time you have left, make peace with the life you had. Sure. All right, Sarah says, I'm sorry, we hoped for better results, but there's a proliferation in your lungs. We hope we reduce by using chemo and radiotherapy. I like this. Saying, sharing emotions, right? Empathizing. I'm sorry. I'm sorry. We really hoped to find better results. So the doctor is connecting in that moment with the patient. Having what we said in the beginning is so important, which is an informal enough language to demonstrate and share empathy. Would anyone else like to share before we see? 10 more seconds. All right. Here's what we have. It's long because this is a hard one. It needs more language. So we have your test results indicate you have lung cancer. So the beginning is still essentially, I mean, it's not sugar-coated. It's just as direct. While it is advanced, we have several treatment options, including chemotherapy and radiation that can help manage the disease. Notice they say manage the disease, not necessarily cure, but the focus is on what you can do, how you can help. Although the treatment will be challenging and may cause side effects, many patients find ways to maintain their quality of life. Again, it's the same idea. It doesn't go into the specifics of the side effects, but it says there will be some negative things, but the focus of the sentence is on the positive, that many patients are able to maintain quality of life even when they go through treatments. And then the last one is an expression of support. We'll support you throughout this journey to give you the best possible outcome. All right, I know it's hard to sort of end on a sad note, thinking about the challenges really of communication in these extremely, extremely intense and sad scenarios. And so many of us have our lives touched by those who've lost their lives to cancer. So I wanted to put this in here. I want to be sensitive that maybe also for someone, this is personal. This does hit home. So we're going to move forward. We did layman's terms and we did sugar coating. So now we're going to talk about a few other phrases that you will hear commonly when discussing communication between doctors and patients. We have doctor empathy, we have informed consent, we have trust, and we have professional boundaries. So doctor empathy is the one we've spoken the most about tonight already. So this is the ability of a physician to understand and share the feelings of their patients. It includes recognizing patients' emotions, demonstrating concern, and responding with compassion. So I said at the beginning that some doctors even hug their patients, but that's not exactly the standard. The standard is just when you're sharing information with a patient or when you're with a patient who has to make a really difficult decision, that the doctor uses language that is empathetic, saying, I care, I'm so sorry, I can't imagine what you're going through, we are here for you as a medical team, do you need more time, how can I help, is there any information you need? So the doctor's role is not simply delivering technical expertise, but also empathizing with the patient as they're in his or her care. Informed consent. So informed consent is something that is extremely important in the United States as well as other countries. But I know the United States the most, so that's my example. So informed consent is a process in which a patient voluntarily agrees to medical treatment or procedures after being informed about risks, benefits, and any existing alternatives. So I'm sure you know that in the United States, we have a culture that is, we call this litigious. This is a fancy word. Litigious is a word for legal culture. People sue each other. It's very common that people sue people going into, let's say I had bad treatment at the hospital, I'm going to sue the hospital. Or, someone says my family member passed away and I don't think they weren't given information about the risks. So I'm going to sue that hospital, I'm going to sue that doctor or that clinic. So the culture has created a lot of requirements. And one of these requirements means that patients have to have signed a document that says, I acknowledge that I was informed of all the possible alternatives, of all the possible risks, of all the benefits, of everything relevant. And then we can say, okay, the patient knew what they were doing when they chose their medical path. I mean, I'm bringing up kind of I would say the negative side of why we have informed consent, right? Talking about lawsuits. But in general, it's also a really nice practice to have in any medical environment that the patient who is accepting the care of the doctor is themselves educated about their own care. If they're choosing not to do a procedure, it's because they have all the information they need. So informed consent is a goal in any medical context. Then we have professional boundaries, which are, this is really about ethics. You do have some legality here as well. Basically saying that doctor and patient's dynamics have to be appropriate. The doctor is the authority in the room and shouldn't have any kind of, I don't know, unprofessional or personal dynamic with the patient. The doctor is in a position of power. They are the individuals with knowledge. They are the ones who are translating the test results and delivering information to the patient. And so the doctor needs to respect that role and make sure that they remain a professional authority figure in the room. And trust. Essentially, without trust, nothing can happen. Patients have to trust that their doctors care about them, are doing things in their best interest. And also, patients need to trust doctors enough to share. So you'll hear stories about a patient who got bad medical advice, and the doctor will say, but he never told me about this condition. Maybe he was embarrassed. Maybe it's something that he didn't feel comfortable talking about. So in order to have actual effective communication, there needs to be a baseline of trust between the doctor and the patient. All right, I'm going to move ahead a little bit just because I can see that we have a lot left. And we're running a little bit short on time. Okay. So let's move on. We've been talking about doctor-patient interactions. Tell me if you see the new slide. Now I'm looking at doctor-doctor interactions. Can you tell me in the chat if you see doctor-doctor interactions on the slide deck? Yes, 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 good. All right, so when are you going to need efficient communication with other doctors? Well, here are 4 cases when doctors are going to be talking to each other. And if you're in this group, if you're attending these courses and you're a medical professional and you're trying to learn English, it could mean that you yourself will be in a situation where you'll be speaking in English to other medical professionals. Maybe you want to work in an international environment where the language in the hospital is English. Maybe you want to attend conferences or you want to do research in collaboration with English-speaking colleagues, okay? So this is all about that type of communication. So the most common times we might find doctor-to-doctor communication, we have mentorship and teaching. So that can be a doctor is your teacher in medical school or is your mentor, is your guide. Peer review, this is in reference to research. When you produce research for journals, other doctors review the research. They review your test results, and you'll be responsible for communicating about it if they have questions, if they want to validate what they see. Effective communication for handoffs. So handoffs is when a patient who is under the care of a doctor, that doctor doesn't work 24 hours a day. So when the doctor's shift is over, when it's time for the doctor to go home at the end of the day, a new doctor comes and takes over that patient. That change is called a handoff, and the doctors have to communicate well so that the new doctor who's coming understands the condition of the patient before the doctor goes home to sleep. And then the last one, multidisciplinary teams and consultations. These can be, in the case of patient care where you have different types of doctors. So you have a neurologist, and then you have a surgeon and an internist, and all of the doctors are taking care of the patient, a slightly different part of the patient's condition, but they will be required to work in tandem. Oh, you can't see the screen again. We'll do a stop and reshare. Yeah, this is why I didn't have the call the class yesterday, because the connection's been so bad, but I thought we got it fixed. We'll see if it keeps happening. Tell me, do you see the slide deck now? Good? Yes? Okay. This was what I was just talking about. These are the 4 areas: mentorship and teaching, peer review, communication for handoffs, and multidisciplinary teams and consultants. So what are some key elements we need to master for this type of communication? These 4. Tell me, you should now see a slide with 4 circles on it. Do you see this? 4 circles. Yes, good. Okay, so in order to effectively communicate with other doctors, in English, of course, we're going to touch on 4 different communication techniques or tools at your disposal for good communication. We have slang, we have colloquial terms, we have abbreviations, and we have jargon. First, let's define these. Okay, slang. What do we use slang for? Generally, slang is specific to a certain group, a certain subset, a certain region, and it's often used to express identity. So you might find yourself in a hospital having a sort of a slang or something with the team. But usually we use slang more to talk about regional dialects, ways of shortening words, or other kind of fun language play. We have colloquial terms. Colloquial terms are going to be very localized language, and it helps us communicate informally or naturally. That's kind of when the hospital has its own specific way of talking about things that's only specific to that hospital or to that clinic. And if you went outside to another hospital, even down the road, they wouldn't be using the exact same terminology. Abbreviations, these are a little more widespread. They tend to be specific to an industry. So abbreviations are used to streamline and simplify communication. And then jargon. Jargon is about technical information. So jargon is like technical words that if you're not in the field, you would not understand. So jargon is almost the opposite of layman's terms. Sarah's asking, slang and jargon are not the same thing. No, they are not. So slang is about informal language. Slang is usually when we sort of rush words together, or we use English in a kind of not grammatically correct way. So it's considered informal, and it's also considered using English somewhat incorrectly. Maybe English is a living language, so what is incorrect today might end up being accepted tomorrow. But slang is that process of taking a normal type of English and slightly changing it. Like an example, maybe if people say, I'm vibing to this music, that's kind of a new word. You can call it a slang word to say vibing, and it's quite informal. You wouldn't use that in a work environment. Jargon is very different because jargon is technical language. When we were looking at the example earlier of the word prognosis, prognosis is medical jargon. It's a word that you only use in a medical environment, and if you weren't familiar with medical terms, you wouldn't understand. Thank you for the question, Sarah. Why do we use these terms and shortcuts instead of the full words? Efficiency and speed, standardization and interdisciplinary use, privacy and confidentiality. If we use short words, if we use slang words, sometimes the privacy of a patient might be protected. And then on written reports, it's because we don't have enough space. Let's look at some examples of what we're talking about. So here's some medical jargon that you might find in a hospital. These are technical terms that not we, because I'm not a doctor, that the hospital staff are using as a way of identifying a situation. So you've probably, even if you're not a medical professional, you've probably seen these in TV shows like ER or Grey's Anatomy. These are different codes that have to do with the condition of a patient. So code black means this patient is posing a threat to him or herself, like they need to be restrained. Threatening behavior, maybe they're posing a threat. We think they might harm someone or ruin property. Code brown, external emergency. Yellow, internal emergency. Orange, evacuation. Red, smoke or fire. Purple, bomb threat. Blue, medical emergency. We often we usually hear, so just so you know, these jargons are not, this list of codes is not the same for every hospital. So don't take a picture of this and assume, oh, in America, this is what all the codes mean. No, different hospitals will have slightly different codes. Usually they are somewhat overlapping, okay, because doctors and professionals in the industry, they're not going to be able to remember major differences, but you do need to confirm the exact code for the institution that you are in. Great, let's talk now about colloquial terms and slang. So here are some good colloquial terms for the medical context. So when we say someone is crashing, we're not talking about them crashing their car. We're talking about that their condition is rapidly deteriorating, so they might be at risk of dying. I'm sure that these terms that are about to come up on the colloquial terms list, you've seen in TV shows. Like he's crashing, she's crashing, and you hear like beep, 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 like all the medical equipment. Oops. Oh, I skipped really far ahead. Wait for me, please. Wait for me. This is where I want to be. Are you seeing colloquial terms in front of you? We did crashing, now we're on rounds, excuse me. Do you see the same slide I see? Yes, okay, good. So next is rounds. So this is great vocabulary for understanding how doctors work. They typically, in the department they're working in, so let's say they're at the gynecology, obstetrics floor, like where women go to give birth. Let's say once an hour, they do their rounds. It means they check on every single patient who's there in the hospital that day, and they usually do it in a group. So one doctor will present the patient to the other doctors so that everybody is up to date on the condition of the patients in the hospital that day. That's called going on rounds. Flatlining. So flatlining is absence of heart activity on an EKG, which is the machine that shows you an echocardiogram. It shows you the heartbeats. So flatlining, it's, quite literally what you see, which is a flat line, like meaning that your heart has stopped, that you are in a state of cardiac arrest. And the last one is to be on call. So when a doctor says they're on call, it means they're available to respond to, it means they're at work. Oh no, sorry, excuse me. On call is when you're not at work, but you are responsible in case they need you to come back to work. So a doctor who's on call cannot be far from the hospital or from the medical clinic. Usually, nowadays I'm sure they're not doing this anymore, but when I was growing up and back in the day of the pager, right, they would have a pager that would beep really loudly if they need the doctor, because a lot of times a doctor who's on call will go to sleep. They go to sleep, and then if there's an emergency, the pager is so loud it wakes them up from their sleep and they have to rush into work. So being on call is not being at work, but it is required that you are available and close to the hospital in case of an emergency. Is there an off call, says Amina? Maybe some people say I'm off, but they wouldn't say I'm off call, they'd say I'm off. You are either on call or you're off work. There you go, off work. All right, we're gonna do some abbreviations. We have BP for blood pressure, HR for heart rate, RR for respiratory rate, O2 sat for oxygen saturation, BMP, basic metabolic panel, EKG or ECG. I usually hear when I watch medical shows, EKG. CT, this is also from last week when someone said, what does CT stand for in the big machine where you get your scans? Well, we have it here, computed tomography. And MRI, magnetic resonance imaging. Something I want you to know about these abbreviations is that people only in the medical field are only using the abbreviation. They are not ever saying computed tomography. They only say CT scan. So they fully replace the language, the full words, with the abbreviation. Here are a few other abbreviations. ICU, the intensive care unit. STAT. This is a medical term, but also you can use it anywhere. It's actually originally comes from military jargon. and it just means immediately. Stat. Get here, stat. I need those test results, stat. Similarly to that, we have as soon as possible, ASAP, which I'm sure you know you can use outside of a medical context. It is very similar to stat. And then we have NICU. So the NICU is actually an acronym for the Neonatal Intensive Care Unit. This is for newborn babies when they are born and they're sick or they were born too soon and they need, either to go on a respirator, like a machine to help them breathe. Sometimes babies suffer from something called jaundice, where their skin is yellow and they have to go under a special light. So any care for just newborn, by just newborn babies, I mean babies that were just born in the immediate aftermath of being born, go into the NICU. Here's an example of a conversation with all these acronyms. We have someone saying, what's the BP and HR on our new admit in 204? What does it mean in 204? Can someone guess? What is 204? Tell me in the chat, what do you think it means? Our new admit in 204. Yeah, okay, good. Sarah says room. Lala says patient's room. Yep, exactly. So because this is a group of doctors that work together all day, they know the names or the numbers of all the rooms. They maybe only have 12 rooms, maybe they have 20 rooms. So who is the new admit, the new patient who was admitted in room 204? Good. All right, the doctor says BP, blood pressure. BP is 140/90. HR, heart rate, is 88. He came in with chest pain, so I ordered an EKG. Awesome. All right, so let's look now at some different healthcare professions. These are also going to have some quizzes. So if you don't know the answer, don't hesitate. It's not something you're required to know. But if you do know the answer, I'd love to see it. So the first one you should see on your screen right now, I'm on a quiz. What about now? It should say quiz. What is the difference between physician and doctor? I think I figured out the problem. It's using the audience window. Okay, I can do that. What is the difference between a physician and a doctor? Who can tell me? Who knows? I mean, this is also where I'm relying on our medical professionals a little bit, but I'm here also to identify the difference in the language. Physician and doctor. This one's hard. It's a little bit of a trick question. Okay, we have doctors work with patients. Physicians are examiners. They are the same. Any other ideas? What is the difference between a physician and a doctor? All right, let's see. All physicians are doctors, but not all doctors are physicians. A physician is a specific type of doctor focused on diagnosing and treating medical conditions, whereas doctor can apply to other professionals. This is why it's a trick question. You can be a doctor of something, like a doctor of history. It means that you've received your PhD in history. So I know it wasn't fair, but I just want you to know that if you see doctor before someone's name, especially, written like DR, like let's say I'm a doctor, which I'm not, but if I had my PhD, they would call me Dr. Knight, but I am not, in fact, a medical doctor. But if we had, let's say, a doctor in a hospital, maybe my imaginary sister is a doctor in a hospital, not someone with a PhD, and they'd call her Dr. Knight. So these two share the same title. I know, it was a trick. All right, here are some medical doctors. This is not the exhaustive list, okay? Just to make sure that you are exposed to the language of how we refer to our doctors. We have surgeons, dentists, psychiatrists, radiologists, ophthalmologists. All right, this is just 5 examples. I want to see if anyone here knows the difference between these three different types of eye doctors: optician, optometrist, ophthalmologist. Do we have any specialists in the room with us tonight? Any eye doctor specialists? I'm going to give you a few minutes. Okay, optician makes the glasses. Ophthalmologist is a physician. Ophthalmologist is an eye doctor. Ophthalmologist is the doctor who treats the patient. Great. Opticians study paramedics, and ophthalmologist is a doctor who treats eyes. I'm hearing a lot about optician and ophthalmologist, but what about optometrist? I see optometrist measuring vision. Great. Optometrist prescribes glasses. Ophthalmologist is the doctor. All right, it seems that we agree on a couple of these basic points. Thank you, everyone. Here are the three definitions. Essentially, what I saw in the chat was largely correct. Optometrists provide eye exams and help treat some eye conditions, whereas ophthalmologists can do surgical treatments. They are both doctors. The big difference is the surgical treatment. And you were right in the chat to say that opticians are focused on, we have here the technical way of saying it, fitting and dispensing corrective lenses. Okay, but opticians are the ones that make the glasses that fit you for the right glasses. The prescriptions for those glasses, the people who measure what type of lens thickness you need, those are the doctors, optometrists and ophthalmologists. Good job. Let's talk about some group of healthcare professionals we call allied healthcare professionals. So these are professionals who work in the medical field, but they are not doctors. So first we have nurses. The most common ones that we will find working alongside doctors are nurses. We have pharmacists, all right, dispensing medication. We have dietitians and nutritionists, which are not technically medical doctors, but they do work in the healthcare field. Chiropractor, I would add chiropractor as well as acupuncture now is another big one. So chiropractor and acupuncture were considered alternative medicine, and alternative medicine is a term for kind of non-strictly medical. Sometimes people think of them as a little bit spiritual. A lot of them take their practices from Eastern countries like China, Tibet, Japan. So chiropractor is the one where someone touches your back, and it's not a massage, but they sort of realign your muscles, your joints, etc. And acupuncture is the one with little needles. I'm going to put it in the chat. Acupuncturist. Yes, Chinese needles, exactly. Very, very small needles in anywhere, back, arms, legs, feet. Mohammed is asking, nurse is for both male and female. Yes, we have the same word for male nurses and female nurses. They're both called nurses. Good. Speaking of nurses, can you tell me what is the difference between a physician, a doctor, and a nurse? What is the difference between a physician and a nurse? Who has some ideas about the difference? Okay, diagnosis and treatment versus care. Okay, interesting. Thank you, Amina. Yassina, a physician diagnoses the patient and the nurse administers medication. Okay. A nurse is not a doctor. It's a doctor's assistant. A nurse is the assistant of the physician. Care versus cure. Very interesting. An interesting way of putting it. The primary role of a nurse is to be a caregiver for patients, managing physical needs, preventing illness, treating health conditions. A nurse doesn't do surgery, okay? Anything else? All right, I'll show you what I have. Physicians are highly trained medical professionals. Well, let me be clear. Physicians and nurses are both highly trained medical professionals. By this, we simply mean that physicians do more years of training. So physicians are highly trained medical professionals who diagnose and treat illnesses, while licensed nurses provide direct patient care under the supervision of physicians. So I think everything in the chat was correct. Nurses are in charge of patient care, working closely in partnership with doctors. Great. Let's look for a second here about different types of therapists. So therapist is a process of someone who's helping. We have the mental health side of therapy, and then we have the physical side of therapy, but it's largely around the theme of rehabilitation. We have physical therapists, we have psychologists, we have speech therapists, okay? And this, as I said before, this list is not exhaustive. It doesn't include everything. It just has a little bit of a taste. Can you tell me, what do you think the difference is between a psychologist and a psychiatrist? This is a hard one that medical professionals probably think is very simple, but I'd like to see if you know, why do we have two different types of mental health doctors, psychologists and psychiatrists? I'll give you a minute to share in the chat what you think is the major difference. Psychologist, psychiatrist. Okay, psychiatrist is a doctor, psychiatrists are physicians. Great. Psychiatrists treat an organic, not sure I understand that one. Can give drugs, says Amina. Okay, but which one? Psychologist gives more of a moral support and cannot prescribe medications, but a psychiatrist is mostly for diagnosing and giving medications. Okay, interesting. Tell me more. Psychologist can't prescribe drugs, but the psychiatrist can. Okay, interesting. Anything to add? Psychologists are not allowed to give drugs to the patient. Okay. Let's see if we have anything else that comes in, and then I'll show you my answer. 10 more seconds. All right, here we go. So psychologists typically focus on psychotherapy, which is all about talking, discussing, changing mindsets, improving mood, and counseling. Well, psychiatrists are medical doctors who specialize in diagnosing mental health disorders and prescribing medication. One thing I want to be clear about, in English, when you say drugs, we largely are thinking about illegal drugs. So we need to be clear that when we are talking about this, we're referring to pharmaceutical drugs. Even when we say pharmaceutical drugs, it has a slightly negative connotation. I prefer medication. Okay, medical doctors can prescribe medication. Another way we say this is we can say psychiatrists can write prescriptions. They have the possibility, the authority, the legal right to write a prescription for a patient, whereas a psychologist does not. So instead of saying they can prescribe drugs, I prefer they can write a prescription or they can prescribe medication. I'll put that in the chat. They can write a prescription or prescribe medication. And that, simply is just about the connotation. Our association with drugs has more negative associations. All right, next we have emergency and acute care. So we have paramedics. We have EMTs, and this is a position where we really use the acronym EMT. These are emergency medical technicians. All right, both paramedics and EMTs you will find coming to, oh, you don't see the slide. Oh, classic. Classic, I did it in the wrong way again. All right, here we go. So emergency and acute care, hopefully you can see it now. We have paramedics and we have EMTs. Good, thank you for letting me know. As I was saying, both paramedics and EMTs respond to emergencies. What do you think is the difference between them though? They both respond to emergencies. So why do we have two names? Why do we have two different names? I'll give you a hint that one of these has more responsibility than the other. Okay, what does an EMT mean? Let me show you the slide that defines EMT while you think about the answer. An EMT is, oops, I think that's not the right way to share the slide. An EMT is an emergency medical technician. Emergency medical technician. These are both people that will arrive at a medical emergency outside the hospital. So they will arrive on the ambulance, for example. All right, so which one do you think has more training? The paramedic or the EMT? Just take a guess. Which one has more training? Okay, we see EMT, we see paramedic, more, okay. Just take a guess. Because these are, I think, some, possibly these positions are unique to the English-speaking world, to the American medical system. All right, I'm seeing more people saying paramedic, but only by a little bit. We have some guesses for EMT. All right, let me go ahead and show you. Paramedics. All right, so for those who said paramedic, good guess. Paramedics have more extensive training and they have a broader scope of practice, so they can perform more advanced procedures and provide a higher level of care. It simply comes down to training. So EMT, emergency medical technicians, it's easier to become one, it's less training, therefore it's less responsibility. Paramedics have more extensive training and are more, I would say they are the superior, excuse me, in an emergency, they are the superior medical professional on site. The EMT is a lower level and very important medical professional as well. All right, let's just go through one last thing before I let you go. This is about who the last type of interactions. I'm going back now to the types of interactions that you would have as a medical professional. We talked quickly. Oh, I didn't change the slide for you, did I? So we talked about doctor-patient interactions. We talked about doctor-doctor interactions. The last one I want to touch on just quickly before we wrap up is doctor to other healthcare professionals, because you need good communication in the medical field to also talk to a whole network of connected professionals. All right, examples of those include some of the examples we just saw on in our quiz section. So we have pharmacists. So doctors are very regularly going to be communicating with the individuals who dispense medication, who give medication to patients, because pharmacists may notice something. They may say, I think this dosage is incorrect. Or they may realize, you know, the person who is getting prescribed the medication is not picking it up. They're never coming. They're leaving their medication untouched. So the communication between doctors and pharmacists is critical. We have lab technicians or technologists. So lab technicians are the ones who do the blood work. So when a doctor, let's say, takes a sample, they might take a stool sample, they might take a blood sample, a urine sample, or a spit sample. They'll take something that needs to be analyzed at a lab. So they will therefore need to be speaking with the individuals who work at the lab to make sure that they get good test results in a short amount of time. Healthcare administrators, so individuals who run clinics, urgent care clinics, or hospitals. There's a lot of administrative roles. We have secretaries, we have a director, we have maybe assistants who help running the administration, things like human resources, hiring, salaries, running the finances, etc. So doctors are not just in a space where they're only talking to other medical professionals. They'll also be talking to business professionals in related departments. And then Social Security administrators. These are going to be individuals that have to do with hiring, that have to do with benefits, employee benefits, and most importantly, interacting with the insurance providers for their patients. So I know that insurance works differently in every country, but generally speaking, a doctor will first diagnose a patient and then recommend a plan of action. And the insurance agency, whether it's CNAS, like here in Algeria, whether it's state-run, whether it's private, they will have to validate the procedure before the patient can do it. And they usually only validate procedures that are considered necessary. So something aesthetic, let's say like, I don't know, the most classic aesthetic procedure I can think of is a nose job. People want to redo their nose. Well, your insurance agency isn't paying for that because it's not medically necessary. It means that the insurance agency is often talking to doctors in order to validate that procedures are medically necessary, and then they will know if they are going to cover them. So there's a whole communication that will happen between doctors to insurance or Social Security administrators and patients. There's a triangle there. So if anything that you take away from this presentation tonight, which I'm just about to close out now, it's truly that communication for doctors is critical. There's so many individuals that they're talking to. There's so many different communication needs that depend on the type of conversation they're having. That having good communication skills in any language is critical, and understanding communication expectations when you're speaking English as a medical professional is also critical. So I actually am realizing now I don't have my question slide up. I usually have a question slide. I forgot to put it here, so I'm just going to put you on our next class slide. But please tell me your questions. We have another few minutes here. So Summa, will we find these on YouTube? Yes, all of these sessions are being recorded and they are posted on YouTube. When they are posted is a good question. Maybe in a week, we will have them posted on our YouTube channel. And I will put in the chat our YouTube channel because I'm realizing it didn't make its way into the slide deck. We are American Institute. Oops, missing a T, Institute-DZ. You can find us on YouTube and all of these slides will be posted. I hope this was useful to you. I hope to see you next class, and I hope to see you all soon. Thank you very much, everybody. Have a great rest of your evening, and I'll see you next week.